50,000 a day. And we have started to invite large numbers of people now working in the care sector and care homes to undertake those tests, and significant numbers have. I might now pass over to Stephen, who may have the precise number.
Yes, thank you, David. So I think a few days ago, the Chief Medical Officer, Chris Whitty, gave a very clear description here at this podium of the sort of strategy that scientifically we would have to think about adopting in order to ensure that we don't see a rise in infection, in the spread of the virus in the forthcoming months, and in order to make sure that we don't put ourselves at risk of a second peak of infections. And that's broadly to make sure that we keep the transmission rate below that number that we always talk about, that R of 1, which essentially means ensuring that we don't go back to a situation where one individual is passing the virus on to one or more individuals. That the rate needs to be below that. That there are a number, scientifically, as you have heard in these press briefings, there are a number of different measures and different approaches that can be taken to keeping that R level below 1, that transmission rate below 1. And that is exactly the work of SAGE and independent scientific experts to work out what that range of measures look like. And of course, school closures is one of those measures. I think it's highly likely that there will be different combinations of measures, some of which are in place at the moment, but others that you have heard about, such as more sophisticated track and tracing, that in combination will keep that number below 1. It's the role of the scientists, such as me and others, to look at that and to provide advice, but of course it's the role of government, quite rightly, to look at those and decide which particular combination is the appropriate combination to take forward. I think on testing, I don't have much to add other than to say that testing is clearly expanding at the moment. In the NHS, we're responsible for testing in hospitals, and we are expanding testing in hospitals. I know outside of hospitals, testing is expanding as well. And I think what's important is that that continues to expand so that those residents in care homes who are symptomatic and asymptomatic and care workers have access to that testing.
Thank you very much. Next we have Inigo Gilmore from Channel 4.
Call a question to the Minister, if I may. We've been hearing very serious concerns, Minister, about the lack of public health experts who manage infectious disease outbreaks on your government advisory group. SAGE. We now know that Dominic And secondly, a question to Professor Powers. We've been speaking to a local director of public health who says that data is just not being shared by central government, and it makes attempts to properly contact, trace, and deal with local outbreaks. When is that going to change? And what's your best estimate of when it might be possible to restart contact tracing again?
Well, the important thing to note is that SAGE is unusual in the way it operates as an expert advisory group, in that it is convened in response to specific emergencies. And the scientists that go on to that group will change depending on the type of the emergency. And it is important that those scientists are able to have discussion themselves, free of external influence, and also that we protect their own security as well. So for those reasons, we don't publish the names of those on the group. However, their minutes and their deliberations are published. And Stephen might be able to tell you a little more about that.
Yeah, so I'm a member of SAGE, that's in the public domain, and personally I have no problem providing people give permission. I think the Chief Medical Officer has said the same, with the names of participants in SAGE being published. Clearly that's not my decision, but I'm perfectly happy for my name to be in the public domain. On the question of contact tracing, you broke up a little bit, but I think the question was, when is contact tracing likely to come in and be effective? So I think there's probably a general comment on contact tracing. So contact tracing, which is a very tried and tested way of managing outbreaks, it's more difficult in an epidemic,